All right. Welcome, everyone. Welcome to Change for Good. My name is Rosa Ramirez Richter, and I'm director of our Chicago Programs and Policy for Healthy Schools campaign. We're excited to have you here for the Change for Good Town Hall. We have some amazing speakers with us today, and we are also gracious for your participation as well. So today, we're excited to be welcoming people from across the country to Change for Good. While we're getting settled, we'll love to hear where you're from and what you're looking forward to hearing about in today's virtual town hall. So please utilize the questions chat box, and we'll read a few out loud of where people are coming from. And let's see. Okay, so I'm thrilled to see our Healthy Green Schools and Colleges Steering Committee members and partners with us today, as well as our Friends of Healthy Schools campaign. I see some board members and some of our amazing parent leaders. Thank you for joining us. I do want to share some tips for you to get the most out of our session today. So let the technology gods be with us. So on the slide, for the best viewing experience, please select the everyone on the webcam. That's the viewing option at the top of your screen, and select view full screen. And by clicking on the small square in the top right of the control panel, you'll be able to access that. So if you have any questions or you come up with some trouble, technical difficulties during today's event, please reach out to us using the questions chat box. We have staff standing by to assist you. And for the post-event networking sessions, we'll be using GoToMeeting, and you can find the links to those rooms in the confirmation email that you received, and also in the program book, which you can find in the handout section on your webinar control panel. We'll also, just in case to make it easy, we'll also add the links to the chat closer to the end of the event. So it looks like we have others joining us from the South, also people from our hometown here in Chicago. So welcome. And then again, as a reminder, as you're hearing these amazing presentations and our speakers, I really encourage you to use the question box to get your quick feedback or immediate reactions on the important issues that we'll be touching upon during these presentations. So with that, we will start with a welcome from Mike Farrell, President of Advocate Children's Hospital, and one of our presenting sponsors. Mike will be joined by Rob Rogers. He's HSE's board chair and president of School Health Corporation. Welcome, Mike.
I'm pleased to be here with you, and Advocate Children's is very proud to be a presenting sponsor for this important event. We're committed to the health and wellness of children, and we know that schools is an important place for children to learn, to thrive, to access crucial services, and support their physical, mental, and emotional health. We're happy to be a longtime partner with Healthy Schools campaign. In this strange world that we're living in today, now more than ever, we must focus on the needs of children, families, and communities. So thank you for being with us. And now I'd like to introduce Rob Rogers, board chair of the Healthy Schools campaign. Rob?
Thank you, Mike. My name is Rob Rogers. As Mike mentioned, I am board chair of Healthy Schools campaign and president of School Health Corporation. I want to thank Mike Farrell and Advocate Children's Hospital for being a presenting sponsor of Change for Good. They are joined at that level by GCM Grosvenor. Thank you to Northern Trust, our gold sponsor, and to Blue Cross Blue Shield of Illinois and Trammell Crow, who along with my company, School Health Corporation, are today's silver sponsors. I would also like to thank Healthy Schools. I'd also like to thank Healthy Schools campaign's silver sponsor, Northern Trust. I'm sorry, gold sponsor, Northern Trust. Our silver sponsors, Blue Cross Blue Shield, Trammell Crow, and my company, School Health. And I'd also like to thank Healthy Schools campaign's board of directors, our dynamic staff team, the members of the Friends of HC, and the foundations, individuals, and corporations that support our work. We literally could not do this without you. I'm excited for the program we have for you today. Our country and world have fundamentally changed in the last 7 months. And instead of trying to move forward as we always have, we must take this moment to fundamentally change the way we prioritize and fund our public education system and recognize the essential role schools play for our children, families, communities, and country. Now it is my pleasure to introduce Rochelle Davis, founding president and CEO of Healthy Schools Campaign.
We welcome you today to discuss a vastly different world than the one we imagined just a few months ago. We are in the midst of a pandemic that has upended life as we know it and a racial reckoning that is long overdue. The magnitude of the coronavirus pandemic is shining a spotlight on the importance of schools as community anchors that children and families rely on for so much more than an education. It is also exposed the vast inequities on which our education and health system are built. More than 56 million children attending elementary, middle, and high school will start their studies at home this fall. They will all encounter academic, social, and emotional challenges. Wealthier parents will counter this with homeschooling pods and private tutors. Other families, including the 30 million children who rely on school meals, will face a learning environment with growing inequities. In addition, children with disabilities, learning differences, or behavioral issues are at greater risk of not receiving crucial services or supports. Instead of offering a safe and measured plan to address these inequities, President Trump encouraged states to withhold funding from schools that don't open on schedule. This is a moral outrage. Across the country, we are hearing from school superintendents who know that they do not have the resources to open schools safely. Governors whose requests for support have gone unanswered. Teachers who want to be with their students but have vulnerable family members. And parents who are afraid of sending their children to school and are worried about the long-term trauma facing their families. And everybody knows someone who has been impacted by COVID-19. This is what we have come to as a country. There is no national vision, no comprehensive plan to help schools reopen safely. There are no plans to protect the most vulnerable or to provide assistance to the children and families most affected by the spread of the virus. Instead, each day creates new uncertainty and fear. The infrastructure designed to support our children's educational and health needs and the needs of families and communities have failed spectacularly. We have not invested equitably in school facilities or in school nurses and social workers. School districts are trying to do their best for their students, but without support or resources, they are being set up for failure. This is a pivotal moment in our nation's history. Amidst these massive and simultaneous failings, we must rise to the challenge of fundamentally rebuilding these systems. This is our opportunity to make changes for the long term, an opportunity to change for good. The title of today's event is also the framework for a set of recommendations we are developing to rethink the education system, including the services it provides beyond the essential task of teaching our children. Some of these ideas are not new. In fact, they've been championed by organizations and communities for years. But now is the time to act and work together. Healthy Schools Campaign brings an important perspective through our work at the intersection of health, education, community, sustainability. And this is where we think we can have a big impact and be an important partner and ally. We are calling for increased federal investment and cross-sector solutions that accurately reflect the importance of our country's public schools. The pandemic has highlighted vast inequities, both in terms of health disparities that disproportionately affect communities of color and the unequal educational resources schools and communities have on hand to meet the immediate needs brought on by the pandemic. Change for Good imagines an education system with health and equity at the center. First, we need federal investment to rebuild America's schools. Too many students are learning in crumbling and unsafe buildings, and the outdoor spaces at our nation's schools are in terrible disrepair as well. A recent report shows that 54% of school districts must replace or repair major systems. This is the level of disinvestment we must address, starting with our most underserved communities. We are very proud of Space to Grow, our innovative partnership to rebuild schoolyards and through green stormwater infrastructure make Chicago's communities more resilient to the effects of climate change. Historically, there has been almost no federal funding for school facilities, but now it is the time to make an unprecedented investment in school facilities, and we can do that in a way that both protects children's health and makes our communities more resilient. We also must rebuild school health services. Schools are an important part of the healthcare system, particularly for our nation's most vulnerable children. Yet the burden of paying for physical and behavioral health services in schools has largely fallen on the education sector. We have helped states expand Medicaid-funded school health services, and we know that access to health services is key to helping students thrive. The federal government should incentivize the expansion of school health services by increasing its Medicaid contributions to states to cover health services delivered in schools. We must change the way schools are funded at every level of government in a way that accounts for the impact of poverty and structural racism. There can be no equity when the wealthiest districts receive thousands more per student than the poorest districts. We need to go beyond equal funding. Students in poverty and from historically underinvested communities must need more funding than those in wealthier communities. We call on the next administration to support states, districts, and schools in developing new approaches to creating adequate and equitable funding for schools. Finally, we must restructure how we procure and distribute school food. Hunger and food insecurity are significant and growing issues, and schools are an important setting for addressing these crises. It's simply good public policy to offer free and nutritious school meals for all students. Doing so ensures equitable access and reduces barriers to national school lunch and breakfast programs. We look forward to sharing more details about this important work in the coming weeks. We have submitted recommendations to both presidential campaigns, emphasizing what the next administration can do on day one to improve student health and the health of our nation. This moment requires the bold thinking and pragmatic action that Healthy Schools Campaign is known for. Our organization has a 20-year history of working in partnership to develop successful programs and advocate for policies at the local, state, and national levels. We also have deeply rooted connections to local schools and grassroots leaders. The world we find ourselves in is not the world our children are destined for. This is our moment to strengthen schools and to rethink and rebuild our education system for the long term. A significant investment in schools would boost the national economic recovery, show that our country understands the value of public education, and create lasting change in every community. So let's ask ourselves, what if we don't go back to the way things were? What if we create an education system that centers racial justice and equity? What if we remove barriers to healthcare for students so that they can be healthier and focused on learning? What if we invest in school buildings and schoolyards that support both children's health and the environment? What if we make healthful food available to all students? In other words, what if our education system changed for good? This is our moment to demand these changes. We hope that you will join us. Thank you.
Thank you so much, Rochelle. Thank you for those inspiring words. At Healthy Schools Campaign, we have the privilege of working with a dynamic group of Latinx and Black parent leaders through Parents United for Healthy Schools, and they've really been at the forefront of creating change at their schools and their communities. And as well, we have an amazing cohort of principals, teachers, and community members. So in an ideal world, we'd be able to hear from all these people in person, live, but as we all know, we're living through less than ideal times. However, nevertheless, we are excited that this virtual format gave us the opportunity to think outside the box and share this collection of grassroots voices with you now. This short video represents just a small portion of the amazing conversations we've had. And just like many of us over the past several months, these leaders have dealt with spotty internet connection, interruptions from the littles, from the kids while recording these videos, but those minor technical issues do not dilute the powerful messages in this video. So we are so honored that these teachers, parents, principals, and community members have welcomed us into their homes, their offices, their schools, and shared their challenges, their fears, but also their hopes as we head into a new school year and also into the upcoming elections. We know some people have experienced audio issues with the video, so please check the chat box if you're having issues or send a question through the questions box and we can help you troubleshoot. So for now, please enjoy this collection of testimonials.
I think what schools need to prioritize when they do open back in the fall for our children to be physically, mentally, and emotionally healthy, I think it's important that we have adequate counseling as well as different things for our wellness teams to make sure that the kids are having fun while they exercise.
Schools are not funded equitably, okay? They don't have enough resources to educate and support our kids and families right now. We need more funding for our schools. Nurses, we need more counselors for our schools. We need support services for violence prevention. We need intervention services also. We need more special education support.
Moving forward, I think it would be great if we had more school personnel who were educated in identifying and treating adverse childhood experiences that play a toll both on a mental and physical aspect of health. And I'm hoping that when we see racial justice, that we can see some of these adverse childhood events go down and hopefully really have a better outcome for these students.
So I think the priority for the district and for my school will be making sure that teachers are equipped to support students' social, emotional well-being and health. There is a way to do that, and making sure that we're doing it in a way that's timely, that is geared towards the actual current events in the world right now. In many ways, so many ways that I do or communicated with parents or have thought about how we educate children has been reimagined since COVID, and I definitely don't think we should ever go back to doing things the way they used to.
We are worried about the physical health and safety of our students and their families, as well as all the stressors that they're experiencing right now in this really kind of tumultuous and unknown time.
I believe that coronavirus is here to stay for a while, and so we're gonna have to adapt. But I think that we have to make the world as normal as possible for our kids, and that's going to be through them understanding and education. I think that this is an opportunity for the Black community as a whole, collectively, to look at what it is that we need, what it is that we lack, what our schools need, what our children need, so they can thrive.
So there's just these little things that I think COVID has given the opportunity and kind of the bargaining power for teachers to say that we have needed more resources, we've needed more counselors, we've needed a nurse in every school, we've needed all of these things, and now as a society we're kind of being forced to reconcile with that and either provide those resources or kind of admit that we don't care about a group of students. And I think that when that call for equity and justice is so widespread and everywhere you look, that teachers can't help but to embed that more into their teaching. And this is not a new type of pedagogy. I think that a lot of Black and Brown educators have been doing this without recognition for years and years and years, but now you're getting a lot more white educators who are trying to teach that way as well.
Bueno, yo deseo la salud y el bienestar en las escuelas como la máxima prioridad, porque ahorita estamos viviendo en tiempos de pandemia, en la cual es bien necesario que nuestros niños sean alimentados con comidas que sean realmente saludables, que se les den a los niños también la educación física y que realmente no deba de haber esos recortes. Se nos debe de dar las oportunidades igual que en todos los distritos escolares. Entonces, ¿cómo vamos a salir nosotros de la pobreza si no se nos dan las oportunidades? Entonces, yo sí exhorto a la comunidad afroamericana y a los latinos a que unamos fuerzas para hacer ese cambio, porque unidos somos más fuertes.
So it seems our video got cut a little short, but the last speaker had really had a powerful message for us in her remarks, was saying that united we are stronger together. So I really hope you were able to really feel the essence of these powerful voices and the important messages that they all had for us to hear. And, so with that, I'm so pleased to introduce our next speaker, Dr. Bechara Choucair, the Senior Vice President, Chief Health Officer at Kaiser Permanente, and also the former Commissioner of the Chicago Department of Public Health. Dr. Choucair has been and continues to be a strong champion for children in schools when he was in Chicago and now across the United States. And among many accomplishments, he also helped establish the position of Chief Health Officer, which now co-reports to Chicago Public Schools and the Chicago Department of Public Health. Dr. Choucair is a strong ally for children's health and a big supporter of Healthy Schools campaign. So we are so appreciative of your time, of being able to be here today. Dr. Choucair had to record his remarks for today, but will be joining us live later in the program. So please join me in welcoming Dr. Choucair.
Hello, everyone, and thank you for joining us for this virtual meeting. It's no surprise to anyone that the COVID-19 pandemic has radically changed the landscape of our nation's school and school communities. We all have to cope with the new realities. For school, that means adapting to new methods of teaching through distance learning, new means of connecting with students with a variety of mental, physical, and social health needs, new ways of distributing school meals to those who rely on them day in and day out, and new level of stress for teachers and staff. This pandemic has really shined a spotlight on the connection between education and health, and reminds us how critically important it is that we keep that lens in mind as we think about education. Kaiser Permanente has started the Thriving School effort many years ago. It's an all in engagement effort to improve the health of students, teachers, and staff. We believe that schools are a building block of our communities, passionate about ensuring that all students succeed, but they can't address the health of their school employees and students alone. That's why Thriving Schools bring Kaiser Permanente's extensive health management expertise and our partnerships with educational institutions and organizations to support the entire school community. Especially today, as schools around the US contemplate how they will restart learning this fall, the physical and mental health, as well as the safety of our school communities, will be extremely important. Without proper consideration for their health and well being, educators will not be able to teach students, students will not be able to learn, and families will not be able to trust their children are safe. As school systems across the country decide how they will restart their school year, they will likely face an even greater strain as they seek to meet the academic and health needs of students, staff, and teachers with already limited resources. More than ever before, the ability of schools to proactively address the health needs of teachers and staff will be a critical factor for school operations, attendance, and ultimately learning. Kaiser Permanente is taking specific steps to help improve the conditions for educators, students, and the school community amongst this uncertainty as part of our long-standing commitment to the health of students and educators through our Thriving Schools program. There are four beliefs I'd like to share with you this morning. One, we believe that we must ensure that educators, an already stressed workforce, have the information, the resources, and the support to prioritize their own mental health and well being. Two, we believe we must invest in the well being of parents and caretakers, providing them with the resources that they need to maintain their own social health. That means ensuring continuous access to food, housing, and basic necessities. Three, we believe we must support educators in accessing the training and support their need to create equitable, diverse, and inclusive schools. And four, we believe we must set a strong post COVID 19 school reopening strategy at the district level that emphasizes reconnecting and reestablishing safety and routines, ensures school based mental health providers are available to students and staff, and reinforces equitable wellness policies that focus on the whole child, including their social emotional health. That's why in May of 2020, Kaiser Permanente teamed up with the Alliance for a Healthier Generation to survey educators across the nation about overall readiness to reopen schools. Educators pointed out the concerns about keeping students and staff safe when reopening schools this fall, and many recognized that they would need help addressing student and staff trauma as a result of the pandemic. As a result of these findings, Kaiser Permanente developed the Planning for the Next Normal at School playbook to equip school and district leaders with specific, evidence informed guidance that addresses the complex needs of students, school staff, and families. Leading subject matter experts from Healthy School Campaign, Alliance for a Healthier Generation, Shape America, and Action for Healthy Kids partnered with us to develop a playbook that has 5 different chapters. One around mental health and well being, two, physical activity and education, 3, social drivers of health, 4, teacher and staff well-being, and the 5th chapter is about COVID-19 prevention. In the months since the survey was conducted, additional economic pressures and recent events eliminating racial and societal inequity may have exacerbated the trauma students and educators were already experiencing from the pandemic. And as the pandemic continues to evolve and schools adapt their plans in response, Kaiser Permanente will continue to update the playbook with new learnings and resources about topics such as safety and mitigation, physical activity, food security, and housing. Our nation's schools will never be the same as before this pandemic. Classroom teaching, shared cafeteria meals, transportation to and from home, everything that was once in place to educate and care for students must be reconfigured. As part of that reconfiguration, we must consider and possibly replace policies that, whether through design or implementation, have led to an opportunity gap between students of color and white students. When schools eventually fully reopen, they will have to navigate daunting challenges to ensure the health and well-being of students, staff, and teachers with a renewed emphasis on equity for students. The pandemic has obviously brought a tremendous amount of upheaval to so many aspects of our daily lives. And unfortunately, these new conditions have exacerbated older, painful realities. Even before COVID, kids in our country faced adverse childhood experiences, or ACEs, which can affect their overall learning and development and put them at an increased risk for chronic physical and mental health conditions later in life. While ACEs can affect anybody, anywhere, we know that ACEs or exposure to ACEs is not evenly distributed. In the United States, 61% of Black children and 51% of Hispanic children have experienced at least one ACE, compared to 40% of white children. So while we can anticipate that all children will be affected by the social, emotional, and the economic aftermath of COVID-19, Black children in particular will feel this pain even more acutely. Chronic exposure to stress impacts a child's ability to focus and learn. Uncertainty, worry, disruption to routine, and for some, the grief of losing loved ones leads to high levels of stress. Reduced access to friends and other social connections, as well as nutritious food and safe places to play for months, could have lifelong impacts. And while experiences with racism are not new to Black children, the latest calls to end racial injustice in America have likely unearthed additional trauma. As we move forward, our schools and our education system should help ensure children and families are safe, supported, and healthy, and that students receive the education they need and deserve. This can be a reality for schools across our nation if our leaders invest and prepare now. Thank you.
Thank you, Dr. Choucair, and thank you for sharing your important thoughts and the important priorities you've laid out. I just want to do a quick reminder to all of our participants here with us. Please don't forget to put your questions for our speakers in the questions box. If we don't get to your question live, we'll be sure to engage with you on Twitter and Facebook after the event. But please, this is our attempt to engage with you, so feel free to chat your immediate reactions or questions you have for our speakers. So with that, now I would like to introduce John King, President and CEO of the Education Trust, and former U.S. Secretary of Education. And while at the Department of Education, Mr. King launched our Healthy Students, Promising Futures Collaborative, which has transformed school health services across the country. And we are so grateful for his leadership and partnership. So with that, I'll turn it over to Mr. King.
Thanks so much, Rosa, and thank you, Rochelle, for inviting me to join all of you. It's a pleasure to be a part of this conversation. I'd start by saying amen to all of the comments that have been made by the other speakers. This is a moment of tremendous challenge for our schools as we confront really these twin pandemics, the pandemic of COVID-19 and the consequences it has had for our health and our economy, but also the pandemic of systemic racism that has been with us since the earliest days of our country. And as we grapple with these, we have to acknowledge that they are deeply interconnected, and that's where I want to focus my remarks. We know that COVID has had a disparate impact on Black and Latino communities. Black and Latino folks are 3 times as likely to get COVID, twice as likely to die from COVID when they do. We know that COVID has had a disparate economic impact on people of color, that Black and Latino communities, as well as Native American communities and some communities within the AAPI community, have suffered disproportionate unemployment and loss of income due to COVID-19. And so those health and economic impacts, of course, also affect our students. We know COVID, as has been mentioned previously, has also exacerbated existing educational inequities. Even before COVID, we sadly as a country often gave the least to the students who need the most. Low-income students and students of color are less likely to get access to high-quality early childhood education, less likely to have access to resources in their schools, as Rochelle described. They are less likely to have access to the strongest teachers, less likely to have access to a well-rounded education that includes art and music and opportunities for physical education, less likely to have access to school counselors, less likely to have support in post-secondary admissions. And we see these consequences of our P through 12 inequities in our higher education system. We just issued a report at the Ed Trust called Segregation Forever that shows there's not a single state in the country where Black and Latino students are represented on selective admission public college campuses in proportionate numbers to the Black and Latino percentage of 18 to 24-year-olds. And in fact, in a majority of cases, those selective admission public colleges are serving a lower percentage of Black students today than 20 years ago. So we have these huge equity challenges that have been exacerbated by COVID. We know the school closures had a disparate impact on communities of color and low-income communities. Pew has a study that shows about 79% of white families have reliable internet access, just 66% of Black families, 61% of Latino families. So folks literally have the schoolhouse door barred for them because of a lack of internet access. We know there were disparities in access to devices. And it's not just having a device in the house, it's a device for every child to be able to use simultaneously to do their work at home. Low-income students of color are less likely to have those devices, many doing their work on cell phones rather than on computers. We also know that folks of color were less likely to be able to work from home. Only about 1 in 5 African Americans in the workforce, only about 1 in 6 Latinos in the workforce can work from home. And so kids didn't have that same level of parent support as they did their work from home. And under-resourced districts had less capacity to do professional development and training and support for their teachers around distance learning. So we know the closures in the spring had a disparate impact. And we now head into a fall where in many places we will still be distance and hybrid, and that too will have a disparate impact on low-income students and students of color. But I want to focus particularly on some of the health-related disparities. One, we know that Nearly 30 million kids rely on school for meals. And yet, when school is closed or when school is only operating on alternating days for kids, it means they can't access those meals at school. We've got 14 million kids who are food insecure. A recent survey suggests 40% of Black and Latino families are struggling to reliably have meals for their children. There are solutions. Congress included in an earlier stimulus package something called Pandemic EBT, where folks get a ATM-like card that they can use at the grocery store for those free and reduced price lunch dollars so that they can buy groceries themselves. The evidence is that Pandemic EBT, those EBT cards, result in families having more food than having to get to school to pick up meals. And yet that program expired at the end of last school year. We need that program to be extended. We need it to be expanded to kids 0 to 4. We also need flexibility for school districts to continue some of the things that worked in the spring to get meals to families, like grab and go meals. So there's important work for Congress to do, but we all have to be vigilant that we are paying attention to whether or not kids and families are getting access to food. A second area of focus has to be this issue of internet and device access. We can't leave kids out of school experiences. That has a deeply harmful impact on their long-term academic outcomes, but also their socio-emotional well-being. Third, we've got to focus on those issues of socio-emotional health. I worry a lot about kids who in the spring did not have those reliable connections with teachers and peers. I was a kid whose life was saved by the relationships at school. My mom passed when I was 8, my dad when I was 12. The thing that saved me was the relationships with amazing New York City public school teachers who saved my life, who invested in me, who gave me a sense of hope, who created a space where I could be a kid when I couldn't be a kid at home. I worry a lot about kids who are in homes where there's addiction or domestic violence, health trauma, economic trauma. They need those relationships. Now, some school districts did extraordinary work to try to maintain those relationships via distance. Phoenix Union School District in Arizona had an Every Student Every Day campaign where someone in the district, an adult in the district, was in touch with every child in the district each day. But as we return to school, we've got to prioritize relationships between kids and teachers, access to counselors. We know we don't have enough counselors. We have states where the ratio of students to counselors is like 600 to 1. So we've got to do more to make sure kids have access to counselors. We have to make sure that kids and parents have access to telemental health services. Again, this is a place where Congress could step up and make additional investments that are desperately needed. A fourth area of focus ought to be on physical health and well-being. There's a real challenge when we're doing distance or hybrid that kids may not be getting the level of physical activity they used to get at school. We've got to support parents in coming up with activities that kids can do at home. We've got to, at school, include physical education in the distance or hybrid offerings, so that kids might be doing yoga via Zoom or that kind of activity. We got to build physical breaks and activity bursts into class. So imagine that third grade elementary school classroom that's doing an activity on Zoom. Well, you got to break that up with some opportunities for kids to stretch and get the wiggles out, as we used to say when I was working in elementary schools. We've got to have in place those supports for physical health and well-being, and schools have to be intentional about that. A fifth area of focus has to be on some of these environmental concerns that were flagged earlier. I worry a lot about schools that don't have good ventilation systems and what that may mean if they try to come back to school in terms of the spread of COVID. We've got to invest, as Rochelle said, in that infrastructure. But we also have to look at broader environmental concerns. We know one of the reasons we have disparate outcomes from COVID in terms of health is because folks of color and low-income communities are more likely to have higher rates of air pollution, for example. So we've got to tackle the community environmental issues as well as the within school building environmental issues. Ultimately, I think this has to be, and I was a high school history teacher, so you'll forgive the nerdy history reference, but this has to be a New Deal moment for the country, where we emerge from a crisis just as we emerged from the Great Depression. We emerge from this crisis saying we've got to build back stronger. We've got to have an intentional effort to strengthen our safety net. We've got to have an intentional investment in education on the scale of what Rochelle was talking about earlier. We've got to see this as an opportunity to build a stronger society coming out of COVID-19, not just go back to the status quo before, which was deeply inequitable. I look forward to the conversation. Thanks again for the opportunity to join you.
Thank you, Mr. King. And I think those were incredible remarks, and it's really speaking to the moment that we must rise above the status quo. So at this time, before we move on to our other speakers, you know, if you can just 1 second, I'm having a technical difficulty here. Okay. If you would like to make a contribution of any size to support this incredible work, please click on the link in the chat box and make a gift to Healthy Schools campaign. We've created a special selection of resources to share with you as a special thank you, but also this will just continue to really support the important work that's needed right now to support our school communities. So with that, it is now time for the town hall. We have time for a few questions, but we'll also take note of all the questions and continue the conversations in our breakout rooms and on social media. At this time, I'm going to ask that Rochelle Davis and John King come back and turn on their webcams and join us for this portion. Please remember to unmute yourselves. And also, I'm pleased that Dr. Choucair will also be joining us live. Let's see if we can get Dr. Choucair on. But while he gets on, the first question that was sent to us, and this is for you, Dr. King, we'll start with you. And then if we can go to Dr. Choucair and then Rochelle. How do we support our students and staff effectively at schools in the middle of the pandemic? And this is from Hisney from California.
Yeah, well, look, I mean, one of the challenges we have is that we can't separate what happens in schools from what happens in society. And the fact of the matter is our national response to the pandemic has been a disaster. We still don't have rapid results testing. We still don't have a coherent national strategy around contact tracing. We still don't have a strategy around helping folks quarantine. We still don't have broad public health compliance with guidance like masks. So we are in a place where schools are compromised by the poor national leadership. What we need to do is get our act together, the way some of our international peers have, around getting the pandemic under control. In that context, then we can think about opening schools. We got to make sure that folks feel safe at school, which means we got to have masks. We got to have a system to create physical distancing in classrooms. We got to rethink meal delivery. We got to rethink transportation. And school districts have been doing a lot of that work, but now they're facing these impossible choices because the pandemic is out of control in many states. So we need the federal government to provide the resources so that schools can open safely. We need state governments to make smart, responsible decisions. I worry a lot about governors who are making reckless calls for all schools to open immediately, no matter what the public health guidance. This is a moment for all of us to protect our teachers, our school staff, our students, and our families by saying we've got to do the right things from a public health perspective. We've got to open safely. And where we can't open in person, we've got to make sure that kids have internet access and devices so that we can do distance learning effectively.
Thank you, Mr. King. I'm going to see if Dr. Choucair has joined us. I think he might be muted, so you might need to unmute yourself. But while you,
how are you?
Oh, wonderful. Thank you, Dr. Choucair. So the question was, how do we support our students and staff effectively at schools in the middle of the pandemic?
Yeah, I mean, this is really at the heart of why this work is so important. And that's really at the heart of why we partnered with so many organizations, including the Healthy Schools campaign, to put out this playbook that identified concrete strategies that schools, teachers, administrators, students could put in place to support teachers and students and administrators. I think it's really important to realize that this is the time when so many of our teachers who are already stressed having to deal with additional level of stress. So paying attention to their mental health, to their wellness is going to be so critical moving forward. And it's going to be critical for also the learning for the students to be able to achieve the learning that we would need. It's also important to pay attention to the trauma that students have been exposed to and that might have been re-traumatized in this pandemic, and whether it's the exposure to having to be in lockdown or having to minimize social encounters with family and friends and others, or the most recent issues around racism and police brutality and others. So it's really important to pay attention to all of those, and that's at the core of what the playbook that we put out to the public is.
Thank you, Dr. Choucair. And just for our audience, we'll be sharing that playbook, a wonderful resource on social media and also in our follow-up post-event communication. So look out for that. Rochelle, would you like to respond?
Sure, thank you. So I think that, you know, unfortunately, we're not going to have a good answer because our leaders have failed us. And I think that we have to continue to demand that our schools and communities get the resources that they need. And so far, they've come up empty-handed. And if they do get their act together, it will be too little and too late. And so we do have to turn to ourselves, the NGO community, hospitals, other community resources, and figure out what we all can do to support schools. And each one of us has different resources and assets that can be leveraged, and we all need to figure out what it is that we can do. And we have obviously readjusted all of our programming and all so that we can dedicate all of the support that we have in order to help schools do that. In Chicago, we are working with parents to help them in the here and now connect with the much needed resources and support, and also to help them navigate the changing school landscape and figure out how to make sure that their children get the help that they need as the school year begins, and help them figure out how, if and when Chicago Public Schools reopen, how they navigate that. We are, through our Healthy Students Promising Future Learning Collaborative, and again, thank you, John, for taking that work many years ago to launch that. It is still alive and well and doing amazing work. We are supporting our state agency partners in making sure that students continue to get health services that they would normally get in school, that they're getting them outside of school. And we are trying to walk and chew gum at the same time and work with those state agencies under enormous stress to help them continue to expand their capacity at the same time, so that when school is reopening, they are well positioned to meet the new needs. A very tall order for our public servants, but we are doing the best that we can to help them. We are also working to provide resources and tools to schools on how to properly clean and disinfect schools as they reopen. And next week, we will be releasing some new guidance on how to clean and disinfect. And as we continue to engage with parents and principals and teachers in Chicago and with our partners around the country, we will continue to try to support them in whatever way we can, and at the same time try to work with our allies and partners to make sure that the pressure remains on our political leaders to do what is right, not only for our children, but for our country.
Thank you, Rochelle. So I think we have time for maybe one or two more questions, but the second question that we got in our questions box is, if there is one thing the federal government can do today to make a big investment in schools, what would that be? Dr. Choucair, we'll start with you. I think you might need to unmute yourself to join us. I'll give you a second to set up. In the meantime, Mr. King, do you want to take a go at that question?
Sure. I mean, I'd love to be able to talk about ambitious new forward-looking investments, but the reality is if the federal government doesn't provide about $175 billion immediately to school districts, we're going to see schools making cuts. And think about that. In this moment of such incredible need, we are going to see 10, 15% or more cuts in state aid to schools. That's going to result in laying off teachers, eliminating programs, reducing counselors, reducing investments in things like their partnerships with healthcare providers, right? So the critical thing that has to happen in the next couple of weeks is a significant investment in state stabilization, state and local government stabilization. Now, once we've done that, then we should look at all the things that Rochelle described in terms of infrastructure, funding equity for our low-income students, a serious investment in school counselors and socio-emotional well-being. But we got to start with preventing immediate harm, and that's why we need Congress to act quickly.
Hi, and
Thank
this
you,
is Bechara. I'm sorry, my GoToWebinar and my laptop are not friends, so I apologize about that. Let me, I completely agree, and I think as we're seeing more and more challenges for state and local budgets, it's really critical that we support schools during this time, and the federal government has an opportunity to step up and close those potential gaps that we might be seeing. And I think for me, it also goes back to, one, how do we double down on supporting mental health and well-being programming for students and teachers and administrators in our school? It's also important how we're thinking about the social drivers for health and how we lift up the social health of students and making sure that we're paying attention to those needs that are so critical to learning and education. You know, programs and efforts around food insecurity, housing instability, transportation issues, all of those are really, really critical. And then the last piece I'd want to add is we should always remember that we're in the midst of the worst public health crisis that we've seen in over a century. And we have a big responsibility in doubling down on how do we suppress this pandemic? What are the efforts that we need to put in place in schools and the communities around schools to create a safe environments for learning? And that type of support is so critical. And I think the federal government has an opportunity to step up and support COVID-19 prevention efforts in schools.
Very well said. Rochelle, would you like to quickly respond?
Very quickly, I will say money for schools, as John mentioned, and then, as Dr. Choucair mentioned, money for making sure that we have the infrastructure in place to test and contract trace, because if we can't do the latter, it's really hard to send kids back to school anyway. And so we need both of those things, and the federal government needs to step up.
Thank you. So thank you to everyone, and especially our esteemed speakers. You know, we are out of time, unfortunately, but we will continue this important conversation on social media. We'll also be answering questions that were received over the next couple of weeks using the Change for Good hashtag. And again, we'll be sure to share the playbook Dr. Choucair had mentioned on social media. So thank you again for spending time with us. Again, a big thank you to our speakers and our sponsors and our supporters. If you would like to make a contribution of any size to support this incredible work, please click on the link in the chat box and make a gift to Healthy Schools campaign. And so again, to continue the conversation, if you have time to continue with us, we'll be now breaking up into our networking rooms. You can click on one of the room links in the confirmation email, the program book, or in the question box. You will need to exit this webinar before you can join. And again, those conversations are starting right now. And again, thank you so much for making time and spending it with us to discuss these very important matters. Thank you and have a great day.